All right. Good morning, afternoon, and good evening to our audience around the world. Welcome to today's webinar, The Art of Application, Food Safety Innovations for Traditional Markets. We're very happy to have you with us today. Before we dive in, I'd like to share a few logistical notes. First, to ask questions throughout today's event. Please click on the Q&A button on your Zoom console. Second, today's event will be recorded, and the recording will be accessible on the GAIN website at www.gainhealth.org/EatSafe. So to kick off, my name is Richard Pluk. I am the Chief of Party for the USAID Feed the Future activity, EatSafe. Today, I proudly represent the EatSafe Consortium and the Global Alliance for Improved Nutrition. At GAIN, our goal is to improve the consumption of safe, nutritious foods for healthier diets of all people, especially those most vulnerable to malnutrition. Thanks to the generous support of USAID's Feed the Future initiative, EatSafe works to unlock lasting improvements in the safety of nutritious foods found in traditional markets. We have a special focus on consumers and market actors and their behaviors around food safety. So why is food safety so important? Well, unsafe food, a preventable hazard, is responsible for 1 in 10 people falling ill and the death of at least 125,000 children globally every year, according to the WHO's estimates. Low and middle income countries bear the largest burden of foodborne disease, which costs these countries an estimated $110 billion in productivity and medical expenses annually. While food safety innovations in high-income markets like Europe or the US contribute to improve food safety from farm to market, few of these innovations have been adopted or are appropriate in the traditional market channels where the food safety needs are highest. Traditional markets are a natural focus for food safety efforts. Not only are local markets the main supplier of fresh food in low and middle income countries, they are also a key source for livelihoods, repositories of social capital, platforms for economic development, and they offer the chance for food security and healthier diets. At the same time, traditional markets are often under-resourced and lack formal regulation, supervision, and supportive infrastructure, all of which can increase the risk of foodborne disease. In support of food safety in traditional markets, EatSafe focuses on behavior change. With that, we recognize there are other important and influential factors, such as availability of proven best practices and appropriate technologies, and an enabling environment such as market infrastructure and governance systems that support the success of food safety efforts. This webinar is the second part of a series highlighting the importance of developing proven food safety best practices and appropriate technologies for low and middle income countries, specifically in traditional markets and the value chains that supply them. In the first part of the series, we highlighted consumer-centered approaches to food safety research. In this session, you'll hear insights into the development, adoption, and growth of innovative solutions for food safety, and you will be introduced to 2 of the finalists from the EatSafe Innovation Challenge. So with that, and to begin with, I'm excited to introduce Dr. Delia Grace. Delia is an epidemiologist and veterinarian with 20 years experience in developing countries. She is a graduate from several leading universities, including the National University of Ireland, Edinburgh University, the Free University of Berlin, and Cornell University. She is a professor of food safety systems at the National Resources Institute at the University of Greenwich and leads research on zoonoses and foodborne diseases at the International Livestock Research Institute in Kenya and the CGIAR research program on agriculture for human nutrition and health. Her main research focuses food safety in the domestic markets of developing countries. Research interests include emerging diseases, participatory epidemiology, gender, and animal welfare. Her career has spanned the private sector, field-level community development, and aid management, as well as research. She has lived and worked in Asia, West and East Africa, and authored or co-authored more than 200 peer-reviewed publications, as well as training, courses, briefs, films, articles, and blog posts. With that, I'm happy to hand the floor over to Delia. Thank you.
Thank you very much, Richard, and thank everybody for attending this seminar. I'm going to be talking a little bit about scaling food safety innovations in traditional markets. Next, please. So Richard mentioned the importance of foodborne disease. Indeed, the health burden of foodborne disease is comparable to that of malaria, HIV, AIDS, or TB. And we estimate that more than 90% of that health burden comes from fresh foods sold in traditional markets in low and middle income countries. This realization is very recent, and it has led to interest in large-scale interventions. I'm currently working with 2 of these large-scale interventions with GAIN in Nigeria and Ethiopia, and involved in another 4 in different parts of Africa and Asia. So this presentation is going to go from the small scale to the large scale and answer some questions around, do projects scale? What doesn't work? What might work better? And finish with some take-home messages. So first of all, when we say scale, and we often talk about scaling and sustaining, scaling, can it reach many people? People always talk also about upwards and downward scaling, and sustaining, unlike our friends in the ecosystems, we tend to talk about sustaining as continuing after the end of the project. So first of all, as a little digression, how do we know whether something scales? How can we tell? Next, please. One way we can't tell is by before and after studies. The picture on the screen shows you the increase in mobile phone use in Kenya in one large project intending to get impact at scale, Millennium Villages. And this increase in mobile phones was considered one of the most astounding successes of the project at the midterm evaluation. Next animation. But if you look at the other lines, they show how mobile phone at the same time was increasing outside of the Millennium Villages. So obviously before and after is not very effective. Next. Indeed, in general observational studies, which means anything other than an experiment or a randomized controlled trial, tends not to be a very good way of finding out whether something works or not. These are just a summary of some people who've studied it and generally found that studies which looked very convincing without RCTs, in actual fact, tended not to be sustainable, not to be scalable, and not even to work. Now, of course, RCTs are quite good at telling you whether something works, like will an aspirin cure a headache? But when it comes to complex interventions, it may be that what works in Ethiopia will not work in Burkina Faso and vice versa. Next, please. And so our conclusion is that in order to know whether something is actually scaling, we need gold standard multiple RCTs. Unfortunately, they're expensive, but it's an important message for anybody who cares about knowing whether or not something works and knowing whether or not something scales. Next slide, please. So coming to the next session, the next section of the talk is on what are the different interventions and what their success has been in being scalable and sustainable. Next, please. With GAIN and with other partners, I've spent a couple of years doing lots of systematic literature reviews on food safety interventions in Africa and Asia, training interventions, various other interventions, publishing on most of them. This is just a summary which shows that interventions can be applied at many levels. but that some interventions are quite popular and some are less so. Next slide, please. And when we did our reviews of these projects attempting interventions at scale, we found a lot of problems and very little evidence of scaling or continuing. Taking us back to the lack of design, the poor design using before and after or with and without models or propensity scores or some of these other pseudo experimental methods from which you can't really impute causality, down to failures in measuring, failures in measuring the wrong things, not accounting for unintended consequences, and very rarely accounting for economics or incentives. Next, please. In particular, two major approaches to food safety. One is regulation, and for sure, a modern and appropriate regulatory framework is essential. But we know in low and middle income countries, there's a huge regulation implementation gap that comes up at every meeting I attend. We often find regulation is not appropriate. In many of the countries where we study regularly, we find 60, 90, 100% of food does not meet standards. I sometimes say when 5% of your milk doesn't meet standards, you have a problem with milk. But when 95% doesn't meet standards, you might have a problem with your standards. And moreover, it ties up a lot of the very scarce experts in low and middle income countries writing endless regulation in their offices. Next, please. Next, please. Another popular intervention is training. And again, when we look at it, we find that by itself, training and simple technology rarely scales or sustains. A big study of farmer field schools showed they were good for farmers by 3IE, but they didn't scale or sustain. Everywhere we look at domestic good agricultural practice, it has limited effect, whereas GAP for trade has very good effect. So when farmers are getting a price premium, they can follow good agricultural practice, but when they're not getting a price premium, they don't. In 10 years of investments in safe veggies in Vietnam got less than 10% of the market, and biosecurity never scales for smallholders. Next, please. So many of these investments and interventions we've been looking at and which have tried to scale and sustain haven't worked. What is the more optimistic view of things that can work? Well, we've been working on food safety projects and pilots and large-scale interventions for the last 16 years. And we've come to conclude that an approach, which we call the three-legged stool, can overcome a lot of these barriers which failure to scale. Next, please. This three-legged stool approach, and Richard alluded to it in his presentation, says that three things are necessary and they must go together for scaling to succeed. They are an enabling environment in terms of authorities and infrastructure, capacitating value chain actors and consumers in terms of training and simple technology, and most importantly and most neglected, motivating behavior change. More recently, we've tried this project in Vietnam and Cambodia, in pork value chains and traditional markets. Again, a combination of training, new technologies, incentives and nudges under motivation, and enabling authorities and infrastructure. Next slide, please. Here's a picture from one of the interventions in slaughterhouses in Vietnam, which was a combination of technologies, cheap, simple technologies. In this, it was just a grid, a metal grid, which allowed the pig not to come in direct contact with the concrete, and then various nudges, such as reorganizing water and electrical systems and making a distinction between clean and dirty areas, along with training. What happened is, as so many often happens, that when the project was there, people followed this new approach. And as soon as the project left, well, within a few months of the project leaving, they stopped because it was more effort. But then a company came in and they wanted the slaughterhouse to use the grid for their workers. And lo and behold, the slaughterhouse started using it again. Next. Here's another quick example from Uganda. In this case, there was a combination of different types of storage, improved storage, color-coded storage, lots of buckets, And in this case, the workers did continue with it because it reduced waste and loss, so more money, and it also made their life easier. Next. And alongside with these projects, part of it is getting the authorities, the local authorities on board, or at least not antagonistic. And the other part is having policy at national level, being more pro-poor, pro-informal markets, pro-food safety. And we've been quite successful in some countries. Here is a meeting in Vietnam, for example. Next, please. And at the moment, we're putting some of these learnings together with various other partners in EatSafe projects funded by USAID and implemented by GAIN in Ethiopia and Nigeria. Next. The good thing is, as we study these contexts, we find that there are relatively few behaviors to change. Here is a list of 11 essential behaviors. I won't go through it, but we're fairly sure that none of these are very huge shifts in behavior. None of them are very expensive. And if we can encourage vendors to do these 11 simple things, there will be a big reduction in foodborne disease. And next slide, please. And if behaviors are few, another good news is that motivations are many. Again, here's just a list of some economic, social, and moral incentives which we are investigating and which seem to be relatively potent in Ethiopia. Sometimes when we talk about incentives, people think it's just about money or profits or punishment or penalties. But actually, moral and social incentives such as pride in one's work or feeling honored in your community can be equally powerful in shifting people's behavior, sometimes even more powerful. Next slide, please. So at that, my take-home messages: many food-safe interventions in low and middle-income countries do not scale, but relatively few have been tried because we didn't realize how big the problem was. And of those that have been tried, many of them were set up to fail because they were not really designed either to work or to be evaluated. Scaling must be incorporated from the start. For too many projects, it was a great idea, and then scaling was something which was done as the project came to an end, not the beginning. And now we feel, having done all these projects and learned from our mistakes and written up the systematic literature reviews, we actually are starting to know a lot more about the fail points for scaling and the critical success factors. As I mentioned, we often need to change only a small number of behaviors, and there's a wide range of incentives and nudges to change them. Authorities must and can be on board. And if we put these three things together in our three-legged stool, we think our prospects of reducing this massive burden of foodborne disease are very good. Thank you all for your attention. The end.
Thank you. Do we have to say over? Thank you very much, Delia, for this honest assessment of what needs to be done and not done for scaling food safety improvements and bringing in innovations and best practices into traditional markets. I think there's a lot to unpack there. And, I welcome, as you're sort of hearing these talks, please put your questions and comments into the Q&A chat because we'll have time at the end of the presentations to hear from you about what you think around what works and what doesn't work, food safety in traditional markets. So now we have a video that we would like to play. So that was a way of introduction to the next section of today's webinar. We're moving on and sharing something of the innovation challenge that EatSafe ran earlier this year. And this was in support of our work in traditional markets in Ethiopia and Nigeria. We, alongside other colleagues at GAIN, we developed an innovation challenge to uncover food safety innovations developed by those who buy from, work in, and support traditional markets and their value chains. So the call was sent out in Ethiopia and Nigeria, and we had students, researchers, entrepreneurs proposing their food system innovations that could be adapted and applied to resolve food safety risks. So we had 2 country finals. We had over 700 people submit innovation ideas for the challenge. We had quite an extensive program in each country with the Sun Business Network, with our colleagues at GAIN, and they came up with finalists in each country. And then at the final, there were 3 country finalists that were selected to take part in the EatSafe Innovation Challenge Grand Finale at the Technical University of Denmark on October the 12th of this year. These finalists, and you see them here represented on the slide. There were 6 finalists. They worked on site with DTU technical experts at the food lab to improve their innovations and to compete in a final global pitch with a chance of winning $10,000 US, a grand prize to the overall winner. It was quite a magical week where we all learned so much about some very exciting things happening around food safety. Next slide, please. So the winner was selected based on how well adapted their innovation was to their own traditional market settings. And the selection criteria included food safety and nutritional benefit, adaptability to market conditions and their communities, scalability, and environmental sensitivity. So you can see the big check in the middle of the picture there, and I'm very proud and pleased to present to you our first speaker from the Innovation Challenge, Dr. Helen Wildermichael, who was the global winner of the Innovation Challenge. Dr. Helen Wildermichael is the CEO of Safe Dish Ethiopia and also an assistant professor at Welkite University, Department of Food Process Engineering. Helen received her PhD from Addis Ababa University in chemical engineering under the food engineering stream. Her dissertation is titled Development of Starter Culture for Kocho, a traditional fermented food of Ethiopia. And with that, I would like to introduce Helen. Welcome, Helen.
Thank you, Doctor. Thank you all for joining us. I'm happy to present my innovation idea and also the experience I was gotten from this competition. Next slide, please. Okay, my innovation idea is more related to my PhD dissertation, as Doctor already mentioned. It's improving of instant fermented custom value chain to improve its processing technology. Instant fermented custom it really look like a banana tree, but as the name indicated, it is false banana because the fruit part is not edible. Instead, the root and the stem part used for preparation of different fermented foods. Next slide, please. Food safety, it's an important public health issue in the case of our country, Ethiopia, because foodborne disease, it disrupts life of most of the customer due to the high rate of adulteration. And also in addition to that, there is a hygienic food handling practice across the value chain. Similar to that, incentive to the custom processing method, also there is hygienic handling practice. It's used as staple food, more than 20 million people, and also it's nutritionally benefit. But when we see the processing method, it's very hygienic and time consuming. And next slide, please. It's extremely hygienic and time-consuming process method must be improved to increase the food safety issue. And also people often may use their bare food to processing, and also they use a surface and pit fermentation in the case of fermenting of a product. So it's easily contaminated with a soil, and also it's easily contaminated by different microbes and also different rodents. In addition to that, it's labor and time consuming. It's affect human health. So we come up with a solution how to improve this traditional processing method into safe and easy method. So our solution is, please next slide. We try to design and develop these are the pictures which aren't the traditional processing method. As I mentioned, they use a bare food for processing and also very old and unsafe processing equipment for preparation of their foods. Next slide. And these are also the fermentation process in the surface and also pit. So mostly it's reported Clostridium and Bacillus anthracis as a food safety risk because it's have the possibility to easily contaminate with the soil, poor hygienic and sanitation condition, and also it's easily contaminated with a manure. So mostly it's reported Clostridium as a foodborne botulism reported by a lot of researchers. Next slide. And also when you see the traditional marketplace for selling of this product, fermented product, also it's not safe. As you see here, it's easily contaminated by the microbes. The infrastructure is not good. And also it's, as you see it in open market, and also they already process the food in that marketplace. So it's easily contaminated by dust, particle, and other related food safety risk microbes. Next slide, please. Thus, we come up with a solution to process, to design the processing method by designing a development of processing emulsion, and also to improve the fermentation process. Instead of using of surface and pit fermentation, we design a small fermenter pot, and also we develop a starter culture. As I mentioned, this is one part of my PhD dissertation. So this helps us to make our product safe from contamination, like contaminants, like microbes, insect, bacteria, rodent in the soils, and also improves the quality of our product, increase the shelf life, and also reduce post-harvest loss, and also standardize a fermentation process and make the processing method more easy instead of the traditional one. Next slide. These are our products. We already developed processing machine in the prototype, and now we are already trying to different small. We already tried in small region to practice this machine and to use by our customers. After this competition, also I try to visit some areas just to adopt our customer with these instruments, and also the other is a starter culture to speed up the fermentation process, and also we are introduce a fermentation pot. Next slide. This all helps to have impact to meet a sustainable development goal to ensure access to safe and sufficient food for all, and also we achieve a gender equality. And also we ensure healthy life and promoting well-being for all our community, and also we achieve responsible consumption and production of effort. And these all are what my idea and what's the impact of my innovation idea at all. Now I will continue to what's gained from this innovation challenge. Please, next slide. The experience I got, a lot of experience I got from this innovation. The first one is I was practicing backcasting process. As the name indicated, it is working backward. So this helped me to visualize what is the main solution, how I solve this food safety issue in my country. So it helped me to solve what's the main solution and also what is the other solution for solving of food safety issue related to a traditional processing methods. And also it helped me to what is the outcome, what is the beneficiaries and stakeholders. In general, it helped me to move my idea toward for action. It's helping me to go meet my impact for my communities. Next slide, please. After backcasting practice, the other is I understand what's food safety challenge in our country, and also how to improve the food safety issues in our country by applying of my solution. We have a lot of idea in the shelf, and so we have, but we don't know how to change into a business idea. So by using of this mentoring session, I develop a business model. This business model helped me to show what's a value proportion, what's my idea, differ from the traditional processing method in the case of achieving of food safety, and also what's my customer segmentation, what is my key activities, and also the cost, revenue, and other related things are experienced when I was develop my business model, and also when I was develop a mini business model plan. This also helped me how to communicate the investor. We have a lot of idea, but we have to sell our idea to the investor. So it's need to develop some mini business plans and also investor teasers. This helped me just to modify my proposal into a business idea. And finally, I was experienced how to deliver my idea to any ordinary person, not necessary to use technical words, but to understand any investors and any interested party, how to present my idea. This is also another experience I got from this innovation. And also there's different technological coaching and business development model. To tell you the truth, I totally changed my idea when I was competing in Denmark, because there's a lot of comments, suggestions, and coaching are there in this session. So it's helped me more to modify my idea into a business idea and to implement or to adopt by the customer. The other is a networking. It's a very interesting time during the networking, because you can I can communicate with different experts and also investors. Generally, from this innovation, I got experience. Food safety issue is a serious problem in Africa, especially when compared to the developed country. In all value chains, there is a food safety issues, especially in the traditional market area. There is a huge problem. It's related to the awareness and also the poor infrastructure, that it's need priority for food safety as like food security. We more prioritize food security in the case of developing country like Ethiopia, but food safety issue also a serious problem. So I got experience to give more priority, similar to food safety, similar to food security in the case of food safety also. Thank you all. It's all about.
Thank you very much, Helen, and congratulations again. I think as everyone can see from your slides there, you were a worthy winner And I think from what you told us in Denmark, kotcho is already very tasty and delicious, but your market studies of your final product, you had consistency in your final product, and also they really liked the taste. So, you know, it's a great innovation and business. So congratulations again. Next, I'm very excited to introduce Oyeyemi Fadairo. Oyeyemi is the project lead of the Solarflakes Dryers Initiative. Her background is in food technology, and she is based in Nigeria. Oyeyemi was an EatSafe Innovation Challenge finalist, and she took second place. So with that, I'd like to hand it over to you, Oyeyemi. Thank you.
Thank you, Richard. Good day, everyone. Thank you for joining, and thank you again for this opportunity. My name is Oyeyemi Fadairo, and I'm the project lead for Solarflakes. Solarflakes is actually a solution we are adopting in Nigeria to be able to make use of what we have to get the results we desire. In this context, I mean food safety in our traditional markets. Next slide. Okay, so a little background on the situation in the country. Vegetables in Nigeria actually make up about nearly 20% of the average Nigerian diet. And of these vegetables, we have tomatoes being the most widely consumed one in the country, and the country produces well enough to meet its demand. Unfortunately, about half of this goes into waste because of the high perishability of this particular vegetables. And it's also interesting that in the country of over 200 million people, the most populous nation in Africa, almost 90% of the food consumed are actually being produced by our small and medium scale farmers. Next, please. And the challenge with having our small scale farmers being our major producer, it is actually a very worthy cause that we have a large number producing what we are feeding on, but they have limited access to adequate storage and processing facilities. So many of the produce actually end up as waste, and this deprives the already impoverished people, and then it means that food security is actually threatened in the country, and meeting that goal of the SDGs, goal to zero hunger, might just be impossible if nothing is done immediately. So to salvage the situation, what these farmers, small-scale farmers do is they try to go for the age-long sun drying method for these vegetables to have them in more stable forms and for a longer period. Unfortunately, because of the limited access to adequate storage facilities and processing facilities, they actually perform this operation on the bare floor, and this exposes the produce to human and animal waste, to pests, and sometimes sudden rainfall. And when there's no proper drying, we could also have mold growing on these things, and that could also lead to the production of mycotoxins. And that is why we are coming in to tackle this challenge. Next slide, please. So the solution we have preferred is called Solarflakes. Solarflakes is actually an inflatable solar dryer. It's made of transparent plastic film, that is polyethylene, and then it is also locked by a black reinforced polyvinyl chloride film, and it's powered by solar batteries, photovoltaic cells that charge them. So it makes use of the energy from the sun, and has some fans, axial fans at the inlet that draw in the air from the external environment. And it is heated by the sun rays. The fan blows the heated air across the produce, and we have exhaust fans at the outlets that withdraw the saturated air to keep them dry. Now, the produce in the Solarflakes are actually dried at a faster rate than the traditional sun drying, actually more than 2 times the same rate as the traditional sun drying. At the same time, they have better quality and better safety, obviously, because they are protected from these external factors, pests, waste, and rainfall. It's also very environment friendly, as it actually generates its source from 100% from solar. So it allows for off-grid operation. And this is one of the uniqueness of Solarflakes. It can be easily moved to the farms and to markets where they can be used. It is more affordable compared to other methods that are in a way efficient. However, they are more expensive and they are not as environment friendly as this. Next, please. The opportunity came with gain through the EatSafe challenge, which we participated in this year. And it has been a very, very wonderful experience. We started with a series of mentoring sessions. We had a lot of coaching sessions with both technical and business experts in food safety and business. So from this experience, we were able to design backcasting tools where we could be able to envisage obstacles or challenges that we could encounter as we try to bring our solution from idea to reality, and to be able to overcome them so that we actually get to solve this problem of food safety in our traditional markets. We also coached by some business experts, which helped me and my colleagues, I believe, to be able to look beyond just having a solution, but also to be business-minded and ensure that it's actually scaled through the orders in the market, and also to be able to know what the consumers are actually interested in getting and how to make them agree with the solution and make it their own as well. It helps to, the experience has also helped to look at things from a bigger picture, as we were privileged to get some coaching both at the national and the international level and we're able to get different perspectives. And another opportunity that was presented, next slide please, was that in the last 8 weeks, we have been opportuned to work with the Innovation Lab at the Technical University of Denmark, DTU. We have been working with students in the lab where we have been trying to refine our solution to ensure that it actually is as effective as we want it to be, and we can achieve the goal of food safety, which this is all about. So we have been able to, with our engagements with the students at Innovation Lab, we have concluded that we are going to be incorporating another component in our dryer, which is the microfilters that would help filter the air that is coming into the dryer. And we have different ratings there, but the one that was recommended would help us to filter out some pores from molds and also some of these microorganisms that we are trying to prevent from getting into the produce. It has been a very worthwhile experience, and I can say it is very productive. Right now, prototype is being built, is ongoing. The project to have it implemented in the market is ongoing, and we are really moving quite fast. We hope it can be faster. Next slide, please. So we believe that with this innovation and this solution, we would be able to tackle challenges that are actually peculiar to the Nigerian traditional markets. We'll be able to increase food in the market, and not just increasing the available food for the populace. We're also going to ensure that the food that is made available is actually safe for consumption. It's going to also help us to reduce waste and post-harvest losses that are being incurred by our major food producers in the country. We have better increased income for these farmers, as most of their produce that goes to waste would also be reduced. And then we would have a better environment, so we can be able to achieve this drying in an efficient way, in a way that is faster, in a way that is safer for everyone. Thank you so much.
Thank you very much, Oyeyemi, for that wonderful presentation, and congratulations on sort of all the work that you are doing. And I'm glad to see that both you and Helen have made the most of this connection with DTU, and that there's continuing support from that direction. And I'm sure you're getting further support from kind of people that you were involved with in the national part of the Innovation Challenge. I'd also like to recognize that we do have some of the other finalists and maybe others that participated in the Innovation Challenge on the call. Yezi Chelem, I saw you popped up, so it's nice that you're here with us today. So we'll move on to a Q&A session. We have about 15 minutes. So this is your chance, and we have over 100 people on the call. So maybe you have questions on food safety in traditional markets and their market channels. Maybe you have some experience yourself with developing appropriate scalable technologies, or maybe there's something you'd like to know about the Innovation Challenge or the work that Delia presented, because we're sort of a community and we'd love to hear from you. There was one thought from Anna from Peru, and thank you for submitting your question. And I think you were asking about how important is the participation of various actors and authorities or other types of sectors to create some kind of solution for a more democratic and flexible education, so that it reaches children, youth, adults who do not have access to education, as is the case in your country. I don't know if there's anyone who wants to take that question.
Yes, I can just jump in. I think when it comes to food safety, this has been a somewhat neglected area. I mean, in other health areas, we find that one, by encouraging education, by getting training children and getting it into education curricula when they're young, is quite a good way of promoting health-seeking behaviours. But also children can be agents of change. So when, for example, in a particular culture or society, there may not be a lot of attention paid to food safety, it's often neglected. There's often a misperception that food safety isn't a serious problem, that it won't make you very sick. And in these cases, it can actually be the children who have a role in convincing their parents and communities to act differently. So I think the idea, the suggestion is very well taken, but I would say that having looked at these interventions, we really don't see much aimed specifically at children's education. Thanks.
Thank you, Delia. Yeah, and what we've seen from our research in Ethiopia is how community members rely on medical professionals for their sort of health recommendations, and so but also from families and friends. You know, I think there is an element of food safety that people kind of have as part of their kind of handing down of what to do and what not to do. You know, so we're advised, I think we all know that, not to leave food out. And so I think also just getting the word out so that the community knows about it, and that a parent can have that knowledge to hand down to their children. And then also in countries with a sort of a strong health network and health extension network, making sure that they also have the key points at hand, and that they share them could also be an effective way if you can't reach them through the formal education systems. So we have a question here on Helen. I don't know if you can give more information about your device. Is there any particular, Ayman, Eshra, any particular area that you'd like to know about the device? And then we also have some, maybe if you could add something in the chat there to give us sort of what specifically you'd like to know from Dr. Helen. And then for Oyeyemi, have you tried to evaluate nutritional retention when you applied the two different drying techniques? Oyeyemi, I don't know if you can answer that. I see you're typing an answer.
All right, thank you. I was trying to type the answer, but I think I'll just give that here. For the nutritional retention, yes, we have from literature, from previous researches, we have information that the nutrients are better preserved as the temperature is more regulated. We have between 45 and 60 degrees being achieved, which is fair enough for drying vegetables, which are water soluble, unlike when it is being placed directly under the sun and then it's not controlled and it could be drying for a very long time, which further makes the nutrients to be lost faster. Thank you. But then we are also working to compare different vegetables, as we are not limiting ourselves to just tomatoes. We are also working on other perishable vegetables in the market and would be sending them to the laboratory to compare the nutrients that are being retained after the drying process. I hope that answers the question.
Thanks, Oyemi. Yeah, and people are also asking whether it can be used for other products. There was a question on local brown rice or fada. Have you tried it, or do you know whether it works on other food types?
We haven't tried that, but we have seen the application on grains in other climates, in other countries. So I believe it's possible, but it's not something that we have tried yet. We have started with vegetables and we hope to diversify with time.
Great, yeah, and it seems like you've got a lot of interest and maybe some sort of collaboration with others to test these other food products might be a good way to go. So thanks, Ayman, for giving us. You would like to hear from Helen sort of how it works, how the machine works, and then maybe how the culture works.
Okay, thank you for your question. Our machine is replace the traditional processing machines. So it's working manually and also by using a power. If the places available power supply, they can use a power, and also they use with a diesel. It's make easy to process in addition, instead of using of traditionally made woods. It's replaced for pulverized and corticate in advanced form. It's working in 3 forms. I think it's, if you are go to my question, it's your answer.
Thank you, Helen. So I think the next question, if we could answer it, is from Indalia Mare on the Delia, the volume of traditional food markets in developing nations is very high compared to the formal market. And there is a serious challenge to establish regulatory framework. Could you please share with us the experience in developed nations to ensure food safety in traditional markets? I'm not sure if that's maybe kind of farmer market type markets, or I don't know how you'd like to answer that one.
Yes, actually, I was just going to make that point, Richard. I think it's like when we talk about these markets in low and middle income countries, which rightly has been pointed out, they supply the great majority of fresh foods come from these traditional, we call them traditional, they're often called informal. And sometimes in Asia, especially, they're called wet markets. And these are often rather pejorative terms. I mean, we hear a lot about closing down wet markets. Informal implies it's somehow illegal or there's some problem with it. Whereas the very same markets in high-income countries, we call them farmers markets, which is a much nicer sounding type of market. And yeah, they are more regulated. There are guidelines for them. WHO has issued guidelines for in traditional farmers markets in Europe. And I think that the difference there is that it's a different system. In high-income countries, these markets are more inspected. There's more money for inspections. There's more compliance. There's more. The workforce is often higher educated. There's more penalties for getting it wrong in a high-income country. If you poison a lot of your customers, it's quite likely to be found out because people do things like phylogenetic analysis and they can tell where the food came from, and then you'll get sued and taken to court. And this is a incentive to provide safer food. So many of the the incentives and the institutions which are present in high-income countries and which are quite good at keeping food safe are not present or are not effective in low and middle income countries. And that's why we need, I think, and we've argued, different approaches and different sets of mixtures, especially this combination of training and awareness raising, yes, simple technologies, yes, but an appropriate regulatory framework, which is not always there, constructive and helpful authorities, and most importantly, and most often missed, incentives and nudges for behavior change. So I think that would be my take. Thank you.
Thank you, Delia. Helen, there was a follow-up question on your technology, and is it a technology designed for household level, or, you know, with its affordability? Is there some other kind of mechanism in which you envisage your machine getting out to the communities?
Yeah, it's a good question. Thank you, Sisai, for your questions. Yeah, it's not affordable as such for low-income household, but we plan our model to work with other associations like Women's Association and Farmer Association to purchase one machine and to use to give a service like our milling house. As you know, in our country, there is one milling house, so the people take their cereals to mill in that milling house. So we adopt that method to apply in our machine also. We already start last week. I was in some area, in one of rural area near to Weltite. So we already practice to use one machine by looking for different small scale householders and also small scale farmers. So it's possible to share one equipment for a lot of people, more than 20 communities in the small village. We plan in this way. Thank you.
Thank you, Helen. So I think we're sort of coming to the end here. I'd like to recognize Kike Lomo and your offer as an Ofada processor to work with Oyeyemi. And thank you for sharing your email, Oyeyemi. I hope you've noted that down. And I believe Delia is answering the question on traceability, which is a very important point. What I've seen from my work is that that there is a lot of communication along these local market channels, which maybe can play a role in sort of developing feedback loops, and if there are the right incentives there, I think they can be quite efficient. I'll also ask Abby if you can sort of collect all of these questions. I don't know if they get recorded or not, and some that we haven't answered today we can kind of follow up on. There's also on the street food, the Codex has some guidelines on street food and food safety. It's sort of something quite closely aligned with local markets. So it is something that people are looking at, including GAIN. So I think with that, I don't know if we can, do we have a last slide? And this is additional resources. Well, thank you very much to all of you for attending the webinar today. It's been our pleasure. We're very grateful to have had such a large turnout. We will be doing this again, so please look out. We'll be sharing today's recording, and then we have these additional resources that you can look for. We also have an EatSafe newsletter that we would love to have you sign up for. So with that, I'd like to thank you. I'd like to thank all of our speakers for a great hour talking about food safety and innovations in local markets. Thank you.
Thank you. Goodbye.
Thank you.